Ancient acupuncture texts describe a myriad of clinical indications for each acupoint. However, they do not explain what their dynamics are. I bumped into the single acupoint approach technique by chance while trying to understand better each single acupoint, a process to which I devoted more than 5 years of intensive study of classical texts and contemporary international recognized experts' publications. As I progressed along the study of the points and meridians, the basic question emerged. On which patient should I use this particular point? What is the difference between stimulating, for example, Renmi-4 and Renmi-6? So, in clinical practice, I began using just 1 point per session in an attempt to assert and delimit their individual actions. To my astonishment, in some of these attempts, progressively, the results were spectacular. Not only did I free the patient from almost all their discomfort, but it also did so in a very stable and permanent way. It was as if the insertion of the needle had deactivated the knot where all the patient's conflicts confluent. Soulié de Morant, back in 1939, had already reported this kind of treatment.
The points to be stimulated, just 1 or 2. The acupuncturist, driving for perfection and eager to have a 100% success rate when treating their patients, will practice his skills in this method.
So far, I had never come across to a treatment as successful as what I have called the single acupoint approach. This therapeutic modality should not be confused with the single point method described in the classical text, which is based to use a single point, but always the same one, to treat a specific symptom. Based on the analysis of the functional claims attributed to each one of the acupoints by the classical texts, Jean-Marc Kespi postulated that excepting the command, the back shu and the front mu points, which have general actions, each of the other acupoints should express ultimately specific energetic dynamics in organic physiology. Whenever the corresponding dynamic became hindered, it would resonate on the acupoint to which it maintains an analog connection depending on its location on the body surface. The difficulty, notwithstanding, in determining the target acupoint lies in the fact that most clinical indications of the target point are described in a large number of acupoints. One of the keys to restrict the search of this acupoint would be to previously detect the general meridian in which the global pathology generally resonates. A first approach might be based on the general symptoms, as they can direct the practitioner to some of the energetic channels. However, if the emotional aspects of such vessel were understood, this would provide valuable additional information to help single out the point. Hence the importance of uncovering the psychological dimension of each meridian. I will dwell on the reasons that, in my opinion, justify the efficiency of the single acupoint approach.
We know that the stimulation of any acupuncture point activates the circulation of its entire meridian. Let's take an example. If we needle large intestine 9, Shanglian, we are stimulating the qi of its whole meridian from all the large intestine meridian. But such stimulation, as if of a wave, carries also within the inertia of the preceding channel in the nictameral cycle. In this case, Shangliang's puncture would stimulate the whole qi of the lung channel. But at the same time, it pushes the one that follows. Therefore, the whole stomach channel would be affected too.
Therefore, we will mobilize 3 meridians with just one single needle. Another indirect effect of the stimulation of any single point is that the tide thus generated has indirect repercussions in the meridian that is at the opposite pole of the aforementioned cycle, which is in an inverse equilibrium with the punctured meridian.
I have a personal image of this phenomena. Just imagine you have a glass with water within and you push it around. The moment the water is exerting a maximum pressure on one side of the glass, the opposite side of the glass shall be at its minimum pressure. When speaking about the nocturnal cycle, this phenomenon is called noon-midnight law.
But I suggest calling the meridians related in that way antipodal meridians, as an analogous term to coupled meridians, which defines another kind of relationship between meridians.
This noon-midnight law affecting antipodal meridians, in Jean-Marc Kespi's opinion, implies a deep meaning relationship between two meridians. But there are also therapeutic aspects implied in it. I'll give a practical example. I had a patient who had a dorsal pain, which in my opinion was related to the large intestine meridian. But instead of needling any of its points, I chose the Luo point of the antipodal meridian, which is the kidney one, so I punctured kidney 4. The pain disappeared completely with just one contralateral puncture. That means just one needle on the opposite side of the antipodal meridian affection. So it is interesting to take into account the noon-midnight law affecting antipodal meridians when treating pains. And we generally don't think about it, but it's very useful in clinical practice.
As if all these were not challenging enough, there are acupoints with special characteristics that amplify such effects. For instance, when an acupoint is a crossing point, which means it is the confluence of several meridians. In this case, its stimulation will inevitably mobilize the latter, with all the corresponding effects already described. Finally, due to the fact that every acupoint has his own unique dynamic, derived from its intrinsic nature, Soulié de Morant described that each one of them has a specific effect on different body structures.
Going back to our example of large intestine 9, Soulié de Morant says that the stimulation of this acupoint alone stimulates the large intestine, the yang qi, the central brain, the spinal cord, the flexor hand muscles, all joints, all limbs, the loins, and the contralateral leg joints, as well as at the same time is dispelling the contralateral kidney.
Although such effects are often difficult to understand, in my clinical experience, they sometimes justify some unexpected side effects when stimulating an acupoint. Now that we have analyzed the different levels of mobilization that could be produced by a single acupoint, it seems reasonable to anticipate that the addition of other similar stimulations, needled in the same session, counteracts part of the effects of the chosen acupoint. Therefore, if we assume that a person is suffering from the effects of the blockage of a single acupoint, it seems reasonable to think that its isolated puncture is the option that shall provide the best result. I have successfully applied the single acupoint approach in clinical practice, experiencing its amazing results. And it is the passion inspired by such results what has prompted me to develop a series of online seminars, where I would like to share with students and professional practitioners the findings of 35 years of study and investigations in clinical practice.